Hi, my name is Dr. Junaid Azam. I'm a GP partner at Park Range Medical Centre here, and we have a list size of approximately 3,500 patients. We're situated in inner city Bradford, so quite high deprivation rates, high unemployment, high crime. Like other practices situated here locally, we are trying our best to cope with the demand. We know that the demand has increased since COVID, and we're trying different and innovative ways of patients being able to contact the surgery. So they can use e-consults online, they can send us an email through our secure email, and obviously they can use the conventional methods as well by telephoning a receptionist or coming in person. We ask that when you do contact our surgery team that you speak to the receptionist and are happy disclosing some information about what the query might be so that the receptionist can signpost you to the correct team. So through the demand that we have been experiencing at the practice, we have noticed that we do get quite a few appointments for minor ailments. So that's things like coughs and colds and flu-like symptoms, diarrhea and vomiting. And this is usually when patients are otherwise well in themselves. What we often encourage in these types of patients is that it would be good to check with your pharmacy as the first point of call to see if there are any over-the-counter medications that you can buy, because often a lot of these illnesses are self-limiting. They normally get better within a week or so, and as unpleasant as the symptoms are, they can be managed with over-the-counter remedies. That being said, we would still encourage patients to seek help for symptoms that they are worried about. So, for example, if you've had a cough that's not going away after a couple of weeks, if you're coughing up blood, if you're noticing blood in urine, all the sort of severe symptoms that you see health messaging around with, still encourage people to seek help for those types of conditions. We understand that some of our patients are giving feedback that when they do ring up reception, that they do sometimes struggle to get through and they sometimes find difficulty in the process. What we would say is, like other practices, we are trying our best to cope with the demand as best as we can. So when you do speak to a receptionist, they may ask a few additional questions just to make sure that you're signposted to the correct team. Often we know that, like other practices, there are a lot of patient expectations there, and we'll try our best to deal with them as appropriate as we can to ensure that the patients with the most pressing clinical need are seen first. So with that, we do ask that you trust the signposting process that we have here at the practice. So we have heard some feedback about patients experiencing potential rudeness from staff on occasions. What I would say is that, all frontline staff at the moment are trying their best to deal with the demand in the best way that they can. And we know on occasion sometimes staff don't perform at their best if they are experiencing a lot of demand on a particular day. Often in this situation, we ask patients and staff to both be respectful towards one another and try to understand it from each other's perspective. And I think if there's a bit more kindness from both patients towards staff and staff towards patients, we can resolve the situation a bit more amicably. So we just ask for everyone to be polite and considerate at all times, please. We do hear from patients that sometimes they wish that they could see their named GP or a preferred GP more often, and that it isn't always possible to see their preferred GP. What we would say is that it is something that's changing now in general practice, where often the lead GPs are coordinating a wider team. And then that team could be made up of physician associates, healthcare assistants, practice nurses, and even our colleagues in the community, like community matrons and district nurses. So, although you may not necessarily see the lead GP yourselves, often they are aware of your medical conditions and sort of what's been happening, and they will often converse with the other healthcare professionals involved in your care. So, um, it's just how the nature of teams has evolved now in communities as time has gone on. And for that reason, it's not always possible to see the lead GP themselves, but they are often aware of what's going on and they will try their best to address your needs in the best way possible. So for some patients, we have pre-booked appointments with the named GP where that continuity of care is particularly important. So, for example, these may be patients with long-term conditions such as diabetes or asthma, where continuity of care is really important, and it's really important to see how someone's condition changes over a period of time. So for these specific groups of patients, we do often pre-book the patients with a named GP. So if I'm describing a typical working day for myself, quite often a lot of the behind the scenes work that often patients don't see probably takes up 50% or more of my time. So that would be things like looking at pathology results. So that'd be like blood tests, x-ray results, letters that come from hospitals from other colleagues, routine requests for prescriptions. So all the stuff sort of behind the scenes, and often we sort of have to fill in medical reports as well. So these are things that do occupy a significant amount of our time, but aren't necessarily appreciated by patients because we sort of do them behind closed doors. But they do take up a lot of time, and quite often that's one of the reasons we're not necessarily available all the time for face-to-face appointments, because we're doing this equally essential work in the background as well. So we have heard feedback from patients about their preference for either face-to-face consultations or telephone consultations. And one thing I would like to highlight is that often with a lot of patients that are working professionals, they often prefer telephone appointments because they don't have to take a morning off work. I can ring them whilst they're at work. They can just take a quick 5 10 minute break and have a chat with me. And in that time, we can discuss what their concerns are, and if they need to be booked in either for a face-to-face appointment or if they need a referral, we can do all that remotely without them actually needing to come into the surgery. Often in terms of prescriptions and sick notes as well, I can send all these electronically. So it makes it much easier for certain groups of patients to access the GP. That said, we understand that some patients still do prefer to come in and actually see their GP. For these particular patients, we often triage the medical complaint, and those patients have the highest clinical priority. Those are the ones that then get booked in sooner. So that's the system that we use here at the practice. We book based on clinical need. So one thing it's probably worth highlighting is that we do have a high proportion of our patients that are South Asian, and often we have to tailor our services to meet specific needs of our demographic. So one example would be where we have chronic disease reviews, and we often, at the patient's preference, we ask for their carer to be there so that they can play a role in their care as well. And this often involves pre-booking an appointment with the doctor or the GP that sort of is their main point of contact. And we just find this works better for everyone, because that way everyone who needs to be involved in that patient's care is there. They can make informed decisions about how they want to go forward in their with their chronic disease reviews. So that's one thing that we found works quite well with our demographic.